Law enforcement seized nearly 10 million fentanyl pills just last year. That's an all-time high, according to a new study funded by the National Institute on Drug Abuse. Data shows fentanyl busts increased more than 3,000% over the past 3 years. America's fentanyl crisis affecting communities from coast to coast, rural and urban, red and blue, rich and poor. The CDC reports more than 66,000 Americans died from fentanyl and synthetic drugs in a single year. Law enforcement officers say they're trying to crack down, but that right now they're struggling to keep fentanyl off the streets. Authorities in Oregon say last month they seized roughly 150,000 fentanyl pills and another 20 raw pounds of the drug. In Arizona, a state trooper and Border Patrol agent say they recently found 36 pounds of fentanyl during a routine traffic stop. And just last week in Maine, DEA agents say they uncovered nearly 3,000 pounds of fentanyl hidden inside a can of beans. 3 pounds of fentanyl is potent enough to kill more than 500,000 people. Just 2 milligrams is considered a single lethal dose. And fentanyl isn't expensive like some other drugs. According to law enforcement, on average, a fentanyl pill costs between $3 and $10. Let's turn to Dr. Nora Volkow now. She's the director of the National Institute on Drug Abuse, part of the NIH. Doctor, thanks so much. What has changed so dramatically in the past 4 years, contributing to this spike?
The main change has been a massive expansion on access to fentanyl. Fentanyl has flooded the market across the whole country, urban areas, rural areas, and it's contaminating not just heroin, but basically all of the illicit drugs, including illicit prescription medications.
How has this happened? Do we even know?
It's happened by the fact that there's a large profit basis for people that are dealing with drugs by selling fentanyl. You synthesize it, and the synthesis is relatively simple. And because this drug is so powerful, it's easier to bring across the border because you need much smaller volumes. And the drug is so potent that it has also very powerful rewarding effects. And so you need a minuscule quantity in order to get a large effect. And that is what is driving it, the enormous profit that the illicit drug market can make by selling fentanyl and the highly rewarding effects of this drug.
Doctor, as you know, certain officials are advocating for more treatment options. Others want to see stricter laws and enforcement. In your estimation, doctor, how should the government be approaching this?
Well, we know that the most effective intervention that we can do is actually treat individuals that have a problem with opioids or fentanyl addiction. And there are medications that work actually and are quite effective and prevent them from dying and relapsing into drug taking. They're very effective. It's the most important intervention. A second one that is crucial is providing access to the medication that reverses overdoses so that people that take fentanyl and overdose can be actually revived and to actually save their lives. And then they can be sent to treatment. So treatment is the most powerful tool that we have. We also have to consider the other factor that relates to prevention. What is making people take drugs? What is it that we can do as a society to protect people from drug exposures and from escalation into addiction?
Dr. Volkow, last month, the Texas governor, Greg Abbott, said he wants his state to come down hard on those dealing fentanyl. Here, listen.
This is not a fentanyl overdose. This is poisoning by fentanyl, which we want to make a murder crime in the state of Texas. If you give one of these drugs to somebody and somebody dies from it, you could be prosecuted for murder.
Is that the right policy, doctor? Would that help ease the crisis?
We know that, that punitive, there's definitely a factor that determines that easy access to the drugs makes it more likely that people will get exposed to it. That's one of the factors contributing to it. But the main factor relates to ensuring that there is access to treatment and ensuring that we provide prevention interventions for people so that they don't end up taking drugs as the only solution that they have to escape the problems that they are dealing with in their lives. So we need to give alternatives. And it's simpler in a way to say we're going to penalize everyone. But we have shown that it doesn't work. And we are in this mess because right now, the worst that we've ever been in terms of the number of people that are dying, And it forces us to think that what we've done in the past is not working and that we need to have alternative. And there are many alternatives that have shown to be beneficial, but we have not implemented them.
Dr. Nora Volkow, thanks so much.